So I noticed that Lily has many papers, many abstracts here, that are just too numerous for you to discuss. So maybe you can just pick out a few of them that you feel are very important, that you can give our medical professionals a little history so they don't have to spend all the money to come here.
Well, thanks for that opportunity as well. Lilly Diabetes, both as an innovator in the diabetes space and now in partnership with Boehringer Ingelheim with the BI Lilly Alliance, are pleased to have more than 70 scientific abstracts at this meeting. And to pick just a few is a challenge, but certainly I know I and colleagues wanted to emphasize the breadth of the diabetes portfolio that we have and are representing here. First and foremost, Steve, what is important to us is serving the needs of individual patients with diabetes. We realize that each individual has unique needs, and so offering the opportunity to innovate across the diabetes spectrum, both in type 1 and type 2 diabetes, is important to us at Lilly Diabetes, and for us, important to the diabetes community. A few highlights for us, some you may have heard of in other interviews, is innovation in the GLP-1 receptor agonist space, dulaglutide. My colleague Sherry Martin and her team have done a remarkable job at putting together a very comprehensive scientific package and report 3 unique trials at this scientific sessions. In addition to that, we have detailed analysis of the mechanism of action of a unique basal insulin, what we call a novel basal insulin, so-called basal insulin peglispro or BIL. And in this study, we've been able to demonstrate data in humans that support a hypothesis that this unique basal or long-acting insulin, which are generally used to control fasting glucose in both type 1 and type 2 diabetes, works in a unique fashion, much more similar to how the body's natural insulin acts. That is to turn off glucose production in the liver while limiting or minimizing the excess effects on both muscle cells and fat tissue. Why is that important? Natural insulin is secreted into the portal vein and acts on the liver in the fasting state. Basal insulins are intended to do the same thing, and having one that can adequately control glucose production from the liver while limiting its effect on peripheral tissues may be associated with not only improved blood glucose control, but a reduced risk of hypoglycemia and potentially a reduced risk of weight gain. We had previously reported top-line results of some of the early phase 3 results with this novel basal insulin, which support that. Superior glucose control in type 2 diabetes when compared to insulin glargine, with lower rates of nighttime hypoglycemia, and what seems to be a weight advantageous profile, less weight gain, in some cases weight loss.
So with the new insulin bill, this is only in a phase 1 trial so far?
So the data reported at this meeting are a mechanistic or phase 1 study, but the program itself is completing its phase 3 program, which is ongoing, and the data I referred to are just the top line results from the initial 3 studies completed in patients with type 2 diabetes. There will be additional data in type 2 diabetes and later release of information around type 1 diabetes. And obviously the detailed analyses of those studies will be forthcoming at future scientific meetings.
And do you have a date on when you possibly expect to submit?
So right now, obviously, the completion of the phase 3 program is our priority, but we anticipate that filing for regulatory review should happen by the first quarter of 2015.